Like babies all across the U.S., your baby likely received a routine test called the newborn hearing screening. This allows parents to know the status of their baby's hearing and take action right away if their baby failed the screening. The newborn hearing screening is so important that the Joint Commission on Infant Hearing, or JCIH, has set the guidelines for 1, 3, 6. Why are those numbers important? And what do they mean? Well, that's what we're going to cover in today's video. I'm Dr. Teresa Caraway with Hearing First. We're here to help and support families just like yours who have a child with hearing loss. We want to empower you as your child learns to listen, talk, read, and thrive just like kids with typical hearing. So, what does 136 mean? It means a hearing screening by 1 month of age, hearing evaluation and diagnosis of hearing loss by 3 months of age, and enrollment into early intervention by 6 months of age. These are recommended guidelines to help ensure that newborn babies with hearing loss get the support they need to reach their full potential. To understand more about these 136 guidelines, Dr. Cedric Pritchett, pediatric otorhinolaryngologist, is here to explain what it is and why it is so important.
There's a body of very passionate and smart and experienced individuals which make up the Joint Commission on Infant Hearing. And as they've looked over time and saw the remarkable gains that have developed as a consequence of universal newborn screening, they've set goals and standards for us as the practitioners to reach for. And so 136 really is the sequence of time that we're asked to achieve when it comes to screening all babies who are born for hearing loss by 1 month, 3 months diagnosing, and I guess I should pause to say there's a difference between determining whether or not a child passes or fails their hearing screening versus what level of hearing loss is present and which ears are involved to that degree. So that's the diagnosis. And is that hearing loss permanent or is it temporary, right? Is it some fluid in the ears? Or is it an inner ear nerve problem? And then by 6 months of age, having figured out what is causing this, how do we allow the sound awareness to be elevated to a level that that child now can benefit from conversational speech and language? So that's the 136. Now, over time, we've realized we can do better. And so you're seeing that needle being moved a little bit more to 1, 2, 3, 1 month, 2 months, 3 months, or even a 136 where it's 1 week, 3 weeks, 6 weeks. Now, these emphasize the systemness that goes into this because it takes an engaged and informed parent, a child who is medically appropriate for this. It takes a group of providers who understand and are committed to this. It takes a health system that can support this. And it takes the economic and political stability to allow these things to happen. And as we see that, we realize that we have a chance to reach those children even earlier.
So while we know why it's so critically important to know the status of your baby's hearing and take action, many babies are still not receiving the full benefit of proper follow-up, even though hearing loss is one of the most common birth anomalies. So join us in spreading the word and letting soon-to-be parents know that their baby's hearing will be tested after birth and they should follow up right away if their baby does not pass the screening. Click the link below to learn more about hearing evaluation and diagnosis. Wherever you are on this journey and however you may be feeling, you are not alone. Hearing First is here to help you every step of the way. Subscribe to our YouTube channel and visit hearingfirst.org to find more resources and support on this journey.